Hi guys, so I want to show you this tweet from Ireland regarding the coronavirus. So it says, coronavirus update Ireland, 74 new cases in last 24 hours, 366 cases in total. So there's a breakdown of 59% women, 20% healthcare workers, 42% travel related, and 67% under the age of 55. Now, 59% women is somewhat expected related to the healthcare, because a large number of healthcare workers are women, but 20% healthcare workers is a very serious problem. Of course, healthcare workers are going to be on the front line, but the problem is that these people may not be replaced. If these people get infected, they can't work. So you're going to end up with healthcare staff shortages. You're going to see more and more people on the front line getting sick and not being replaced. These are not people who can be replaced easily. You're going to have to open up the hospitals, receive more volunteers. You're going to have to invite people maybe from abroad to come in to try and support the system. This is very serious, and what it creates is the more numbers you have of healthcare workers falling to the sides, you're going to have more backlogs, you're going to have more stress, more strain on the system, because more and more people are going to get sick, more and more people are going to arrive at the hospital, but there are fewer staff to deal with this illness. Now, the 42% travel related, I assume these are people coming back from infected areas like Italy, Spain, maybe also China. This is a problem that many people have been talking about. Up until recently, the airports were still open. So a lot of these people coming back may not have been checked, may not have been monitored, and they are infecting the areas. And 67% under the age of 55. This is a huge number, much higher than I would have expected, because we associate this virus with the elderly. Now, of course, these under 55 may not all be healthy, fit people. They may have underlying health issues, but we generally associate this virus with older people, and we have to break that myth. We have to understand that anyone can be infected. Unfortunately, here in Italy, there was a story just yesterday or the day before yesterday of an ambulance driver who died from exhaustion and being infected by the illness. He was 46 or 47 years old. He'd been overworked, and then he got infected, and his body wasn't able to fight it because he was destroyed physically. So anyone can actually be infected with this, and unfortunately these numbers, which seem small at the moment, compared to Spain or Italy or China or the United States, are going to get much higher. And I think Leo Varadkar yesterday was right when he said this is the calm before the storm. I really hope everyone the best there in Ireland as well, and in the UK, but things are going to get worse, much worse, before they get better. Also here today in Italy, we had the biggest number of new infections and deaths. I had been hoping that things would level off, but things seem to be getting worse by the day. But I hope eventually things will level off. We're still under lockdown. Things are not getting any better. It doesn't look like things are going to get better, but it's probably the type of scenario that's necessary in order to control this virus. And I hope for everyone listening that you're safe and that you're well, and that you keep yourself in that state and don't get infected. Please, guys, don't get infected. Keep away from crowds, keep away from bars and restaurants. I think in most cases where you're living, they are closed now, finally. And there's some good news also in the UK that schools have been closed finally also. But it's important also that there are resources to help people to survive now, because Many workplaces have closed. Many people have been laid off. Many people have been forced to isolate, and they need support from the state. Let me know in the comments, guys, your situation. How are you dealing with this virus? How is your community dealing with it? All your comments are much appreciated, as always. Thanks.